Hello, my name is Courtney Bush, and I am presenting my topic over the structure of the wrist joint. This includes the description of the joint itself, the joint capsule and the joint cavity, the articular cartilage and articular discs, and menisci. The wrist joint is also known as the radiocarpal joint, which is a synovial joint in the upper limb marking the area of transition between the forearm and the hand. The wrist joint is formed by the proximal row of the carpal bones, not including the pisiform, and the distal end of the radius, as well as the articular disc. The ulna is not part of the wrist joint. It articulates with the radius just proximal to the wrist joint at the distal radiolunar joint. Wrist is an ellipsoid type synovial joint allowing for movement along two axes. This means that flexion, extension, abduction, and adduction can all occur at the wrist joint. All of the movements of the wrist are performed by the muscles of the forearm. Joint consists of synovial fluid. The wrist is not a single joint but consists of multiple joints. It contains 8 small, irregularly shaped carpal bones, which are arranged in 2 rows, proximal and distal. The joints of the wrist are enclosed by a fibrous joint capsule and are further bound together by multiple ligaments which blend with the capsule. In the hand, there is a total of 13 bones that form the wrist and hand. 8 of those bones make up the wrist. These bones are the scaphoid, the lunate, triquetral, the pisiform, the trapezium, the trapezoid, the capitate, and the hamate. The wrist consists of 2 bursa, the ulnar bursa and the radial bursa. The ulnar bursa covers the tendons of the index, middle, and the ring fingers. The radial bursa covers the thumb tendon and extends to the wrist crease. Your bursa play an important role in leading a healthy, active lifestyle. When the bursa are not irritated and working properly, your joints move smoothly and painlessly. However, when a bursa becomes swollen and inflamed, the condition is known as bursitis. When pressure or friction is too great, excess fluid can build up in the bursa sac, causing swelling and inflammation. When a bursa becomes inflamed, moving your wrist becomes very painful and movement can be difficult. Any action that puts pressure on the inflamed bursa in your wrist can increase irritation and cause further inflammation and pain. Infection in the radial bursa and the ulnar bursa is known as horseshoe abscess. Now I will be talking about carpal tunnel syndrome by giving the definition, what causes it, the symptoms, the tests necessary to diagnose this condition, and what the treatment is. Carpal tunnel syndrome is the name for a group of problems that includes swelling, pain, tingling, and loss of strength in your wrist and hand. This condition will happen when the median nerve, which runs from the forearm into the hand through the carpal tunnel, becomes squeezed by damaged tissue inside or outside of the carpal tunnel, otherwise known as a pinched nerve. In general, anything that crowds, irritates, or compresses the median nerve in the carpal tunnel space can lead to carpal tunnel syndrome. A number of factors have been associated with carpal tunnel syndromes. Although by themselves they don't cause carpal tunnel syndrome, they may increase your chances of developing or aggravating median nerve damage. These factors are anatomic factors such as fractures or dislocation, sexual orientation, nerve damaging conditions such as diabetes, inflammatory conditions such as rheumatoid arthritis, alterations in the balance of body fluids such as fluid retention when one may become pregnant, workplace factors, or even other medical conditions such as menopause or obesity. By putting how many different conditions may aggravate the syndrome, it is no surprise that carpal tunnel syndrome is very common in older adults. Some of the tests that medical professionals use to determine the following condition would be a physical examination, where the doctor will test the feeling in your fingers and the strength of your muscles in your hand. Another test is an x ray, as well as an electromyogram, which measures the tiny electrical discharges produced in muscles. During this test, your doctor inserts a thin needle electrode into specific muscles. This test evaluates the electrical activity of your muscles when they contract and when they are at rest, or a nerve condition study. The treatment for carpal tunnel syndrome may include wrist splinting, non-steroidal anti-inflammatory drugs, and corticosteroids. There are surgeries that might be required from this condition, which may include an endoscopic surgery, where the surgeon uses a telescope-like device with a tiny camera attached to it called an endoscope to see inside your carpal tunnel and cut the ligament through one or two small incisions in your hand or wrist. Another surgery that comes with a higher risk is called an open surgery. This is done when the surgeon makes a larger incision in the palm of your hand over the carpal tunnel and cuts through the ligament to free the nerve. During the healing process after the surgery, the ligament tissues gradually grow back together while allowing more room for the nerve than existed before. In general, your doctor will encourage you to use your hand after surgery, gradually working back to normal use of your hand while avoiding forceful hand motions or extreme wrist positions. Soreness or weakness may take from several weeks to a few months to resolve after surgery. If your symptoms were very severe before surgery, symptoms may not go away completely after surgery. Another condition to consider when there is wrist pain would be flexor tendinitis, which is two sets of tendons that are located on the palm side and are made up of collagen and elastin tissue. When the tendons become irritated, causing wrist and hand pain during movement, and tenderness when direct pressure is applied. Another condition is called extensor tendinitis. This occurs when the extensor tendons at the wrist level are strained and the tendon sheaths become inflamed. The last condition that may cause severe pain would be ganglion cysts. These are among the most common masses or lumps found in the hand. They are not cancerous and in most cases are harmless. They occur in various locations, but most frequently develop on the back of the wrist. Repeatedly applying stress to the wrist can cause a ganglion cyst. The cyst rises out of a joint like a balloon on a stalk. It grows out of the tissues surrounding a joint, such as ligaments, tendon sheaths, and joint linings. Inside the balloon is a thick, slippery fluid similar to the fluid that lubricates your joints. Although many ganglions produce no other symptoms, if a cyst puts pressure on a nerve that passes through the joint, it can cause pain, tingling, and muscle weakness. Next, I will be discussing the nerves, the blood vessels, the muscles, and how they affect the movement of the wrist. When we say muscles, that includes tendons. The function of a tendon is that it connects the muscles to the bone. These muscles generally start further up in the forearm. The tendons of these muscles cross the wrist. The flexor tendons help to curl the fingers and thumb, as well as bend the wrist. This band of tissue keeps the flexor tendons from bowing outward when you curl your fingers, thumb, or wrist. The tendons that travel over the back of the wrist, which are called the extensor tendons, run through a series of tunnels called compartments. These compartments are lined with a slick substance called tenosynovium, which prevents friction as the extensor tendons glide inside their compartment. All of the nerves that travel to the hand cross the wrist. There are three main nerves that begin together at the shoulder. These nerves are called the radial nerve, the median nerve, and the ulnar nerve. These nerves carry signals from the brain to the muscles that move the arm, hand, fingers, and thumb. The nerves also carry back to the brain signals such as touch, pain, and temperature. As one can only imagine, constant bending and straightening of the wrist and fingers can lead to irritation or pressure on the nerves. Traveling alongside with the nerves are the large vessels that supply the hand with blood. The largest artery is the radial artery that travels across the front of the wrist closest to the thumb. The radial artery is where the pulse is taken in the wrist. The ulnar artery runs next to the ulnar nerve through the Goyens canal. The ulnar and radial arteries arch together within the palm of the hand, supplying the front of the hand and fingers with blood. Other arteries across the back of the hand supply blood to the hand and fingers. As you can see, the wrist is a complex area of the body. When you realize all the different ways we use our hands every day and all the different positions we put our hands in, it is easy to understand how hard daily life can be when the wrist doesn't work. As I begin to finish up, I wanted to mention a little bit more about wrist injuries. Whether it be bursitis, ganglion cyst, carpal tunnel syndrome, flexor or extensor tendonitis, wrist injuries are a bit complicating. Since the wrist is a joint and not a bone, it is not what breaks. Most frequently, a wrist fracture is a break that occurs at the end or distal part of the radius bone. Good bone health remains important in the prevention of wrist fractures. Maintaining an adequate intake of calcium and vitamin D supports good bone health. Another means of prevention is wearing wrist guards for activities such as biking, skateboarding, rollerblading, etc., where the chance of falling on an outstretched wrist can occur. As you can see, the wrist is a complex area of the body. When you realize all of the different ways that we use our hands every day and all the different positions we put our hands in, it is easy to understand how hard daily life can be when the wrist doesn't work well. This is especially true for independent adults, which are the most affected by wrist injuries.